Hello and welcome into Dental Profits Weekly, where we come to you live each week to talk about the business of your business. It's about happier clients, better results, making more money, and enjoying the process. We got a lot going on today. I got to tell you, it's a little bit intimidating. I've got a camera there, and we're going live on Facebook. I have a monitor here and a second camera there, so I'm surrounded. And hopefully I will not turn anything over and wreck the whole place. My name is Sean Crabtree. I'm really excited that you're joining me. My company is called the Crabtree Group. For the last 20 years, we have worked closely with dentists and dental teams all over North America, the Caribbean, and Canada. From Barbados, as a matter of fact, to British Columbia, from Nassau to the Great Lakes. And one of the reasons that I even got into dentistry all of those years ago is about the very conversation that we're going to have today. One of the reasons that I got into dentistry is this concept of what we call in dentistry treatment acceptance. I come from the sales arena, and for a young guy straight out of 10 years in the communications industry and straight out of college, I thought everybody understood sales and the concept of treatment acceptance. But I learned that that's not the case, and that was very exciting for a young guy like myself. And what I want to cover with you today is several things. Number one, I want you to know that having a very good treatment acceptance is possible. What is that? I'd like you to shoot for 95%. And I know you're saying that is not possible. Or maybe you go, yeah, that is possible because I've done it before. Wherever you are in the spectrum, I want you to know that a 90-95% acceptance rate is doable, and I want to give you 4 things that I'd like to walk through that if you will implement, you can go get that. Number 2, I want to challenge you just a little bit in terms of the way that you're thinking when it comes to treatment acceptance. So with your permission, we'll spend the next 20 minutes or so, and I want to give you all I can from a high-level standpoint about getting you where you potentially could be when it comes to treatment acceptance. Why is this beneficial, you ask? Here's why this is beneficial. Because so many of you watching this right now, or maybe if you're listening to this, so many of you out there are constantly seeking out new patients. You're spending your life trying to market for new patients, when the truth of the matter is you're not getting the full potential of the patients that you have. If you have a 90, let's just shoot for, say, a 90% acceptance rate, that would mean that 9 out of 10 times with complete treatment acceptance, 9 out of 10 times anybody who walks in and presents with something, they walk out excited, accepting the treatment, and have it paid for, and that's where I want you to be, and that's what this whole conversation is about today. I know you can see me looking around. Again, that's because we got all these cameras, and Casey is over here trying to keep me on track. We got a lot of things going on. So if you're driving down the road, stop. If you're watching this, pull out a pen. I want to tell you some things about specifically how you too can have as much as a 90+% acceptance rate. And once we're done, I want to give you a gift. So if this is the year that you want to take your acceptance rate from wherever it is to a 90+% acceptance rate because A, you're tired of the stress, you're tired of the chair time being gone, used up on onesie twosie, and you're tired of dealing with that word non-compliant patients. You want your patients to be more compliant, you want to be excited, and you want to have the fulfillment of having them accept the treatment that they need done. Here's 4 ways or 4 things that you need to implement to be able to get this rolling. Number 1, redefine what a full exam looks like. Awesome. We got 2 cameras going there. Redefine what a full exam looks like. And what I mean by that specifically is this. We talked about this on a previous podcast that we'd done, but not at the level that I want to talk about it right now. All of this webinar series that you're looking at is about the business of your business. There's a great book written years ago by a guy named Michael Gerber. Actually has a series of books. They're called the E-Myth, and there's a whole bunch of different ones. And basically, the premise of all of those books is this. We live in the greatest country on earth, and the greatest country on earth gives you one thing, gives you opportunities. If you are really good at making pizza in America, you can open a pizza business. If you're really good at IT, you can open up an IT business. The challenge is, at the end of the day, the guy who opened the IT business or the pizza shop really enjoyed making and doing one thing, IT or pizza, or in your case, dentistry, right? Here's the thing, and this is what Gerber's whole point is. You can be great at the tactical, technical, clinical aspects of dentistry and still not be as successful as you could be if you're focused on the running of the business as well as the work that you're doing inside the business. And so, when it comes to number one, redefining a full examination, you want to include the business side of the business. And here's what I mean by that. Of course, you're going to do a full examination clinically because, as we all know, a diagnosis without a full exam is malpractice, right? But I want you to include something else in that full examination. I want you to examine what's going on with the heart and the mind and the emotions of the person who's attached to that mouth and all of those things that are going on clinically. The reason that this is important is I've got to get it clear in my mind that a full exam is not a full exam unless I'm also including, in addition to the clinical things, all of those other things that I mentioned. The mindset is the most important thing, and I can't implement the other steps until I get the mindset of what a full examination looks like in my head. I've got to get that ingrained. So from this point forward, after you hear this, a full examination has got to be a complete examination of not only what's going on clinically, but also what's going on emotionally with the heart and the mind and the desires and the emotions and all of those things. And only then have you examined fully once you examine all of those things. Now, if I've done that in my mind and I'm clear about that in my head, then I can go implement the other 3 steps that we're going to talk about in just a second. But first things first, I have to redefine that a full examination is not a full examination unless it includes all those other things in addition to what's going on clinically. Now, the other steps are involved are how do I do that, right? If I'm clear about this in my head, then number 2 is I want to create a basis for that examination. And here's what I mean by that. In other sales training, if you know somebody who's had sales training or if you've had sales training, you may hear something called the setup. You may hear something called the big claim. I certainly use those terms too. But really, the point of it is it's a basis for asking the questions. And so how that looks verbally might be something like this. You know, Casey, we're so glad to have you at the practice as a new patient. My name is Sean. I've been Dr. Such and Such's hygienist. By the way, this could be a hygienist or assistant. I'm Dr. Such and Such's hygienist. I've been working here for X number of years. And I just want you to know that you're going to find that our practice is a little different than most other practices. I'm sure you saw our vision out front. Basically what it says is that we're committed to serving you at the highest level possible. And the only way that we're going to really serve you at the highest level possible is to get some information. It may be some questions that you've never been asked before. So if you need to take a minute to really give me a deeper sort of an answer, I want you to take all the time you need. Okay? Now, that would be a setup, or a big claim. But the purpose of that is to create a basis for me to go in and ask the questions. If I don't create that basis, I'm not going to be able to fully examine what's going on with the heart and the mind and the emotions and the desires of the patient. I'm only going to be able to look at what's going on clinically. And we know now that a full examination is only a full examination if I include all of those things. So that might be how it could look. Then number 3, I'm clear about what an exam looks like in my mind. I'm going to create that basis. And now number 3, I want to implement a systematic approach where we're asking that all the time. Now let me rewind just a second before I go into what number 3 looks like. Doctor, we've redefined in number 1 that a full exam is only a full examination if it includes not only what's going on clinically, but also what's going on emotionally with the heart and the mind and the soul and the desires of the patient that's attached to what's going on clinically. If you're clear about that in your mind, then moving forward, you don't ever want to go into an operatory to make a diagnosis unless or until the second part of that examination is done for you. You're going to be able to look in the mouth and see what's going on clinically, but you want your hygienist or your assistant to find out what's going on with the patient and asking some of these questions. So the basis and the setup for that is going to happen with the hygienist and the assistant before you get in there. Number 3, asking the questions is also going to happen before you get in there so that they can transfer this information once you come in to do the clinical part of the exam and then therefore the diagnosis. So I'm going to create that basis using that verbiage. Now number 3, I'm going to ask. I'm just going to be straightforward and sincere. Once I've created that basis and I've done the setup, the patient now understands why it is that I'm about to ask this question and why it is, how it is that it benefits them. And so they're on the same page with me. And now I'm just going to ask, what's the most important thing to you when it comes to your teeth or when it comes to your smile? And I'm looking for big picture kinds of answers. I'm looking for answers that are emotional. I'm looking for answers that are values-based, and at least, if not values-based, then stories-based. So, let me back up. Here's the way it might go. The hygienist or assistant is going to create that basis. So, Casey, it's really nice to meet you. My name is Sean. I'm Dr. So-and-so's hygienist, and we're really excited to have you as a new patient. I think you're going to find that our practice is a lot different than most other practices. I'm sure you've seen our vision out front, and that's something that we all take very seriously. I'm in number 2. Basically what it says is that we want to serve you at the highest level possible. And the only way in the world that I'm going to be able to serve you at the highest level possible is to get some information from you. Maybe some questions that you've never been asked before, certainly at another dental office. So if you need to take a minute to really give me a deeper sort of a heartfelt kind of an answer, take all the time you need, okay? When I see the patient say, yep, got it, great, now I'm going to ask. So Casey, what's the most important thing to you in terms of your teeth? Or I might say, what's the most important thing to you about your smile? I'm not trying to lead Casey. I'm just looking for big picture kind of emotional answers. If Casey gives me a dental answer, I really just want my teeth straight and white. That's not really where I'm trying to go, but it's giving me some information, so I'll use that to ask again. So you want your teeth straight and white. I've learned that patients want that for all kinds of different reasons. I'm curious, what's most important to you about having your teeth straight and white? And I'm looking for Casey to be comfortable enough and open up and say, I'm not confident. I deal with the public all the time, and I find that I'm not as confident as I could be if my teeth are straight and white. Or, just the other day, and maybe he goes into a story. Just the other day, I was noticing as I was speaking in front of the mirror, in front of a bunch of people, I saw my reflection, and my teeth are not as really straight and not as white as they could be. And I'm not as confident as I could be. I think it's holding me back. Okay, great. Those are the kind of answers that we're looking for, and those are the things that are going to help us help Casey when it comes to finding out what's going on clinically. Now, we know what's going on emotionally with Casey, and we're going to help him accept the treatment. So, hope that makes sense. We've got a redefinition of what a full exam is. We now have committed that if I'm the doctor, I'm not going to walk in and examine what's going on clinically with the patient unless or until I also have had my hygienist or my assistant creating this basis, asking these questions, and then giving that information to me. Now when I walk into the operatory, now I'm going to have the assistant or the hygienist. I think we should go back to the other camera. There we go. I'm going to have the assistant and the hygienist communicate that information in front of the patient. They're going to hand that information off to me. It might go something like this. Dr. So-and-so, this is Casey. By the way, I'm going to introduce Casey, not the doctor. Dr. So-and-so, this is Casey. Casey and I have had a great conversation. The most important thing to Casey is this, this, and this. Now the doctor can go, awesome. Okay, maybe I talk a little bit about that with Casey, just make a little bit of relationship. Now I'm ready to dive into do the clinical examination, find out exactly what's going on with Casey. Now here's number 4. Once I've done all of that, I've got all of that information through the handoff. I've done the clinical exam. I know what's going on clinically. Now here's the big one. Once it's time for me to present the diagnosis, I want to communicate that not specifically only through what's going on clinically. I want the patient to understand that how that gets them what it is that they want, what it is they told me they want. So I'm going to communicate that diagnosis through the stories and or the values that the patient has told me are most important to them. So in other words, when I communicate that diagnosis, I'm going to communicate it now in terms of what the patient has told me is important to them. That is how we're going to make a difference moving forward, and that's how you can get as much as a 95% acceptance rate. The basis of all of this, if you're hearing all this and you're going, geez, Sean, that sounds like a really cool idea, but you know what? It doesn't feel comfortable. And so I'm clear about that. I'm clear it doesn't feel comfortable. But you know what? A lot of things that you're implementing for the first time are not going to feel comfortable. It doesn't mean that they're bad or they're right or they're wrong. It means that you just need to become comfortable doing it. The other thing that's really important if you're going to implement these 4 steps at the highest level is to get clear in your own mind, right? Why do my patients buy dentistry? Think your way through this. Why do my patients buy dentistry? Why do any of us as consumers buy anything? Well, here's the answer. The reason that all of us buy anything is not based on price. It's not based on logic. It's actually based on what's most important to us or our perception of value. When you implement these 5 things, you're not only communicating the diagnosis based on what's going on clinically. You're communicating it based on what's valuable to the patient. And that's how all of us buy as consumers. So if you want to take your practice to the next level, getting clear in your mind why it's important and how it benefits you to implement all of this is the most important part. Then implement these 4 steps. Getting clear in your own mind that a full examination is only a full examination if you've included what's going on emotionally with the patient as well. Now you can create a basis for then going in and asking the questions. You're going to make sure that moving forward, you're asking those questions every single time before you bring the doctor in to do the clinical examination. And the doctor, you're going to present the diagnosis through what's most important to the patient. That's how you can get a consistent 90+% acceptance rate on a regular basis. I know there's a lot of information out there. Somebody told me the other day that the average acceptance rate in a dental office is something like 25% or 35% or whatever it is. You know what? It doesn't surprise me. I actually would have thought that it's less. But I know that it's possible that you too can have a 98% acceptance rate, and you can enjoy the benefits of complete treatment diagnosis, complete acceptance. You can enjoy the benefits of the fulfillment of knowing that your patients are seeing value in you and the dentistry that they need. It can totally change not only the way you practice, it can change your life, and that's what I want for you. I told you at the beginning of this I was going to have a gift for you. Here's my gift. If you're hearing this and you go, you know what, that makes total sense, but I need a whole lot more of it. We've actually created a course. It's an online course, and I want to offer that course specially for you. If you're listening to this, I want to give you a gift. You can have this entire course that obviously goes into all of these details at a much, 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 much higher level. We're talking about 6 or 7 different modules. Is that right, Cam? 6 or 7 different modules. Hours of information that show you exactly how we do this with role playing, and we actually have one of our offices who are doing this. I want to give you this gift for $599, but you have to contact us within the next 10 days. Is that okay? So go to our website, thecrabtreegroup.com, and whatever 5 days from today is, did I say 5 days? Yes. So you have to contact us within the next 5 days. Go to our website. You can contact us through the site. In the meantime, if what I'm saying here makes sense, please pass this information on, share it, comment about it. I'd love to know your comments. If you like this, if you don't like this, if you're implementing this already, I'd love to know what you think. And please subscribe. Find us on social media, find us on YouTube, or go to thecrabtreegroup.com. My name's Sean Crabtree. I really appreciate you spending some time with me. Those of you who are live, thank you for spending time with me here. I hope you found it beneficial. Let me know. I'll see you next week live on the business of your business, Dental Profits Webinar Series, where it's all about you having happier clients, better results, making more money, and enjoying the process. Thanks for joining me. I'll see you next week.